Welcome everyone. I am Nishan Hajra, Assistant Professor of NS College of Pharmacy. Today I am going to discuss about diuretics. So first of all, you have to understand what is diuretics. Diuretics is a type of substance which increase the urine production, or we can say that which increase the elimination of the urine from the kidney. So the question is, multiple types of urination is hazardous for the patient, or it reduce the patient compliance. So why we need the diuretics? Diuretics basically used to treat various types of disease in our body like hypertension, angina pectoris, congestive heart failure, etc. Like first of all is hypertension. What is hypertension? Hypertension means increase the blood pressure. So blood pressure is increased due to the excess amount of sodium in the blood. By using the diuretics, we can eliminate the excess amount of sodium ion. From this process, we can treat the hypertension. Second one is angina pectoris. So angina pectoris is basically, it is a chest pain which is developed in the left side of our chest cavity due to the increased cardiac workload. By using these diuretics, we can reduce the excess fluid flow and we can treat the angina pectoris. Next one is diuretics is also used to treat the congestive heart failure. Congestive heart failure is developed due to the increased cardiac workload, and we can reduce the cardiac workload by reduce the blood volume by using these diuretics. So diuretics is basically used to treat the hypertension, angina pectoris and congestive heart failure and any other disorder. Now we have to understand what is the function of the diuretics. Diuretics have mainly three functions. First one is excretion. So what diuretics do? By using these diuretics, nephron excrete out the excess amount of nitrogenous waste like protein in our body. Second one is maintenance. So diuretics also used to maintain the acid-base balance in our body. So why it is important for acid-base balance in our body? Suppose if our blood contain excess amounts of uric acid, this uric acid is acidic in nature, so our uric pH is then acidic. So by using this diuretic, we can eliminate the excess amounts of uric acid. And we all know that the uric acid is responsible for the gout. So if we eliminate the excess amounts of uric acid, we can treat the gout as well. And by using these diuretics, we also maintain the acid-base balance. Third one is maintenance the sodium, potassium and chlorine ion in our body. Sodium, potassium and chlorine, this is one of the main three ion in our body, because these three ion have various functions. Like if the sodium ion is excess in our body, it may lead to the hypertension. If potassium ion excess in our blood, it may lead to the hyperkalemia. So to eliminate the excess amounts of this ion, we can use two diuretics, and this diuretics is eliminate the excess ion through the urination process, or by increase the elimination of urine from kidney. Now we have to understand what is the process of urination. To understand the process of urination, we understand the structure of the nephron. Here we draw the structure of the nephron. Here we can see this is the afferent arteriole and this is the efferent arteriole, and this is the glomerulus and this is Bowman capsule. Here it is the proximal convoluted tubules. This is the loop of Henry, or also we can say that Henry loop. This is the distal convoluted tubules and this is the collecting duct. So by this drawing, we understand the urine formation. So first process of urine formation is filtration. So filtration is basically done here in the Bowman capsule, or we can say the glomerulus filtration. Here the unfiltered blood is coming through the afferent arteriole here, and we have to understand that the diameter of the afferent arterioles and the diameter of the efferent arterioles are different, mainly half of each other. So it creates the pressure. Through this pressure, here the filtration occurred. That means the unfiltered blood come here in the glomerulus filtration. Here various small pores are present. From these pores, the micromolecules or water molecule, small molecule can filter from the blood and come and collect in the Bowman capsule area. Now next in the selective reabsorption. It is one of the most important process in the urine production. Selective reabsorption, it also known as the rate limiting step, because these steps control the other steps of the urine formation. So in the selective reabsorption, what happened? Through the Bowman capsule, the already filtered materials are come here in the distal converted tubules, but the macromolecule, where the pore size is or the diameter is greater than the pores of the glomerulus filtration, they cannot filter from the bloodstream. So the nephron selectively reabsorbs those ions and they enter the ion inside the distal converted tubules in this way. So it selectively reabsorbs the following ion which is important for our body. This selective reabsorption generally occurs in the distal converted tubules. Third point is secretion. So in the secretion process, our nephron or loop of Henry secrete various types of hormone or various types of unwanted material which needs to be filtered out from the bloodstream. So it secretes various types of ion. That ions comes into the bloodstream and eliminate from our body. In this way, from loop of Henry, it comes to the distal converted tubules. Here various selective here the secretion occur, and finally the materials are collected in the collecting duct, and in this way the urine formation occurs. So in this urine formation, our main objective is how we selectively reabsorption the important material, the material which is needed for our function, body's normal function. Through selective reabsorption, we can reabsorption the ion inside our bloodstream. So in the secretion process, selective reabsorption mainly two types: active reabsorption or passive reabsorption. Active selective reabsorption means these types of reabsorption needed energy for reabsorption, like glucose, various types of glucose, sodium ion, it can reabsorption through active reabsorption process, or water molecule is reabsorbed by passive reabsorption process. Through this, in this way, the urine formation occur, and by the mechanism of action or where the diuretics acts, here we can point out the following things. Like 1, we point out the glomerulus filtration as a 1, and 2 as a proximal converted tubules, and 3 as a loop of Henry, and 4 as a distal converted tubules. Here is the 4. Where the diuretics works, we can classify them into various categories, like osmotic diuretics, like mannitols, or carbonic anhydrase diuretics, like acetazolamide, or thiazide diuretics, like chloramthiolidone. In this way, we can classify the various types of diuretics. In the next class, we explain each of every types of diuretics. Thank you.